Good afternoon, everyone. Myself, Dr. Vinod Kaushik, on the behalf of IIP India Digital Team, just welcomes you all for the today webinar organized by IIP Delhi branch. And the topic of the webinar is back pain rehab and magical integration of pelvic floor by Dr. Dhara Shah. And today the moderator of the webinar is Dr. Payal Kitrpal. And I just shows my gratitude towards Dr. Sanjeev K. Jha, IIP President, and Dr. Ruchi Vashnay, IIP Women's Cell National Head, for providing us this wonderful platform for sharing the knowledge with all the delegates and the students. And I just request everyone, please subscribe your own IIP India YouTube channel and other social media pages of IIP India. Now I just hand over to our moderator, Dr. Payal Khetrapal. Please take it.
Good afternoon, everyone. A very warm welcome to all of you. Today, we are here on a knowledge sharing platform with our resource person, Dr. Dhara Shah, who is a pelvic floor rehab specialist and chief clinical instructor at WOW IIPRE. She is directly trained under Dr. Het Desai sir, who is popularly known as the father of modern pelvic floor rehabilitation. She is a chief clinical instructor and team leader for teachers training program at WOW IIPRE. She is the HOD of Pelvic Floor Rehab Clinic at Ahmedabad. She is also the lead assistant to Dr. Het Desai sir in designing and developing pelvic floor rehab workshops and seminar for physical therapists, gynecologists, urologists, colorectal surgeons, and many more. So the list is very long about the description of Dr. Dhara Shah, and I think I'll fall short of words if I describe everything about her. So without wasting time, and I'll hand over the webinar thing to Dr. Dhara Shah. Madam, kindly start with the presentation and spread your knowledge for which each and everyone is waiting for. Kindly start, madam.
Yeah. So thank you first of all. Before starting my presentation, I would really like to extend my thanks to Het sir for giving us and for bringing this pelvic floor rehab and women's health and integration of it so much upfront. And I'm also thankful to Dr. Sanjeev Jha and Dr. Ruchi Vashnay for organizing such wonderful knowledge sharing webinars all across the IAP team, all across the different states of IAP, and thankful to the moderator of today's session and to Dr. Kaushik as well. So I would be starting my presentation. So today's presentation would be on back pain rehab and magical integration of pelvic floor. Before starting the webinar, I would like to give you a quick introduction of our chairman and founder, Dr. Het Desai sir, who is the entrepreneur, innovator, and author. And he's an author of Amazon's bestseller #1 in urology, physical therapy, and obstetrics and gynecology, Het's Manual of Pelvic Floor Rehabilitation. And for the contribution which he has made in the field of pelvic floor rehab, he is popularly known as father of modern pelvic floor rehabilitation. Our vision is to courageously break the cultural taboo and to make the intimate health, that is core rehab or pelvic floor rehab, accessible to every single woman and every single man on the globe through innovative technologies and services. So sir is also the chairman and founder of WOW IPRE, WOW Experience and Research Development. Both has received certificate of recognition by Government of India. WOW Group of Businesses, World Pelvic Floor Organization. To sir's innovative and intellectual properties, he has developed WOW PF360, WOW Vispa 3, WOW Men, WOW Vagina Fit, WOW Vagina Dilate, and WOW Group mobile application. To his academic contributions, He has hates MMT, which is beyond the boundaries of Oxford MMT, hates FMT, hates self assessment scale, hates providers protection guidelines, hates reflexive result scale, hates female sexual function scale, and hates male sexual function scale. So along with this, let me go to ahead with our today's webinar. So in this, what would be the major agenda of my today's webinar is to make you understand the importance of pelvic floor rehab and how simply can you integrate pelvic floor exercises in all your patients of back pain. So I'm just taking a case study. I'm sure that you all might have seen similar patient to what the case study I'm presenting, but I want to bring a different perspective to the already practiced treatment in low back pain. So the patient named Rita, she's 35 years old. She was married since 10 years and she was mother of two boys, 8 years old and 5 years old respectively. She was working as a receptionist and she had a low back pain since 3 years. Now she consulted multiple orthopedic surgeons and physiotherapists. She always had intermittent pain, means whenever she had pain she used to consult a physio or she used to consult an ortho. She used to take NSAIDs, rest, and uh, hot packs and all to relieve her pain. Okay, so but her pain used to get aggravated when she did heavy activities like heavy weightlifting activities, prolonged sitting, household activity. Now this would be the most common case of low back pain all the physios might have seen, and I'm very sure that right from our second year of physiotherapy we start getting the exposure of the cases related to back pain in our clinical practice, then in an internship, and then when we enter into the clinical setups. So what common assessment do we do? Okay, we all do the basic assessments like we check the body type, we see the posture, we see the pain assessment, that what is the pain on the NPRS, what is the pain during rest and during activities, what different types of manual muscle testings do we do. So we would check for abdominals, we would see for glutes, for quadratus lumborum. Okay, what are the different lumbar movements which are painful, so we would find the painful lumbar movements. We check the range of motion, we check muscle tightness. So in this case all these findings are visible in the screen. And on her assessment she was not having any neurological involvement. Her slumps and SLR were negative. So just to rule out the neurological involvement, we did slumps and SLR also. So all these are the common assessments which we are doing, and we are coming to a diagnosis, a physical and functional diagnosis of low back pain due to XYZ reasons, or pain and limited range of motion, postural disturbances into the into a patient. So and what we do differently is we would not be discussing about the complete pelvic floor hands-on assessment, because it is something which is in depth. But the one who are not into pelvic floor, or one who are seeing the general patients, or you are into general orthopedic, musculoskeletal, neurological, sports or cardiopulmonary practices. So just I'm briefing out that we did HATES MMT, HATES self assessment, which we are not going to discuss. And then we do, what do we generally do? So in routine back pain therapy, in routine physical therapy for back pain, the most common thing we focus on is the manual therapy, exercise therapy, modalities, IFT, spinal decompressions, tractions, etc. So I would like to differentiate one thing over here, is that if you broadly categorize back pain treatment, you can divide it into pain relief and lumbopelvic stability and core stability. Okay, so we are focusing on pain relief. So we would be doing lot many things for pain relief, like giving IFT or going for positioning McKenzie techniques, or all different techniques which are available, spinal decompression, traction. Okay, we go for checking extension bias, flexion bias, and then trying to fix it. So somewhere we are working on the pain, and on the other side for the lumbopelvic stability also, or the core stability also, we are having them do certain exercises or therapeutic measures. But now this is what I wanted to bring to the light, that how many of us do we integrate pelvic floor treatment into our practice? So many of you might come up and say that yes, we do pelvic floor rehab, we ask the patients to go for Kegel's exercises. But in Kegel's exercises, are you sure that whatever Kegels you are teaching to your patient, they are able to practice it correctly? Okay, so research says that almost 98% patients, approx 98% patients, they do Kegels in a wrong way. And why do they do Kegels in a wrong way? Because somewhere the patients are not having a proper perception of their pelvic floor muscles. They don't have a proper brain muscle coordination. I'm not talking about the neurological coordination, but I'm talking about something like knowing that what exactly pelvic floor is. So you just by giving a simple command that try to squeeze as if you are try to hold your urine, try to hold your urine. Just by this command, many of the patient they end up doing Valsalva instead of doing pelvic floor activation correctly. Okay, and this every one of us might have experienced in our clinical practice that no matter what you tell to your patients to perform no matter what you tell to your patients how to practice Kegels, they somewhere end up doing it in an inappropriate way. Okay, because they are not exactly aware of what pelvic floor muscles are, how to integrate them, and how to do Kegels at home, right? So for that, what what we do here, I mean, what we want you all to do is simple take three simple steps to integrate your pelvic floor muscles or pelvic floor rehab in your back pain. Okay, before seeing the three steps, what sort of back pain can be treated if that comes so it can be used for all the types of back pain. Why? Because if I have to explain you the reason why pelvic floor exercises or pelvic floor rehab should be integrated in all different types of low back pain patient, that I would like to explain you with the help of a pelvic model. So this is the pelvic model. As you can see, I'm stopping my screen sharing, sorry. Yeah, so that you all can see my screen. If we can just pin my video for others too. Yeah? So if this is the this is the pelvic structure, or you can say this is the whole pelvis, right? The right sided pelvis, the left sided pelvis, symphysis pubis anteriorly. Then if I just rotate it inferiorly, we have ischial tuberosities, and posteriorly we can see the coccyx. Okay, so the pelvis, and here if we see the other muscles which are attached to the whole pelvic structure, so we have multifidus posteriorly, which gives us the segmental stability or which forms one of the core muscles. Anteriorly we have the transversus abdominis muscle, okay, transversus abdominis, and superiorly we have diaphragm. So all these four muscles, superiorly diaphragm, anteriorly the transversus abdominis, inferiorly the pelvic floor, and posteriorly the multifidus. Now, if you want to explain it to laymen, I would really like to explain it like how Hetzer explains it. So Hetzer always say that if you have to explain pelvic floor, core muscles to some person who is not to a patient or who is not a medico, you can simply make him understand by giving him an explanation that the wall where you are sitting, imagine you look at all the four walls of the room you are sitting, right? So the wall where you are sitting is your back, is your spine. Okay, so this is the multifidus. Okay, the wall which is in front of you and on your sides. Okay, the wall, now you are sitting here over the spine, and the wall which is in front of you and over the sides, like this whole wall, is the transversus abdominis. This is the transversus abdominis. Okay, the fan, the ceiling where the fan is hanging, or the wall where the fan is hanging, is your diaphragm, and the floor where you are sitting is your pelvic floor muscles. Okay, the floor where your leg are resting, that are your pelvic floor muscles. So you need, in order to have a proper stability of your room, you need to have a good integration of your pelvic floor, your transversus abdominis, your pelvic floor, your multifidus, your transversus abdominis, and diaphragm. So only and only if all these four muscles, they work appropriately and synchronously, then you can have a proper core stability, a proper postural stability. Now, just by asking the patient do Kegel, so many patients, especially those who are suffering from mechanical back pain or postural back pain, they have a tendency of relapse, in the sense they would repeatedly come up with pain. Maybe their pain subsides for some duration, again it comes up, again it subsides, so there is a relapse. Now why exactly this relapse is happening? So many a times we think that maybe the posture is, the patient might be doing proper exercises here, but once he stops, he's again getting into his routine, which is disturbing her posture, is his posture. Yes, or maybe the Kegels which we are advising them. Okay, we are focusing on pain relief, we are giving the strengthening of maybe transversus abdominis, we are working for the multifidus, we are asking them to breathe constantly, but somewhere we are overlooking or we are underserving the pelvic floor muscles. Okay, so researchers nowadays, they have shown that whenever there is any increase in the intra-abdominal pressure, so any activity which increases your intra-abdominal pressure, what activities it can be? It can be a simple cough, or a sneeze, or a bending forward, or a lift, or lifting heavy weight. So any activity which increases your intra-abdominal pressure, in those activities, the first muscle to get recruited, or the first muscle which fires, is the pelvic floor muscles. Okay, they are the pelvic floor muscles which would fire first, and then they would be followed by transversus abdominis, multifidus, likewise. Okay, now another thing is, like, whenever your, what is the what how does these muscle, they maintain the core stability? When we are talking about the core stability, what does it mean? It means in proper alignment of the spinal column. It means proper maintenance of the intra-abdominal pressure. It means avoidance of the valsalva. Okay, and a proper breathing. Now, in order to maintain the intra-abdominal pressure, what is the physiology associated with it? So whenever your diaphragm, now pelvic floor and diaphragm, they work in pressure relationship. I always tell this, that don't neglect pelvic floor in any of your patients. You might be treating ortho, neuro, sports, or even cardio patients. Okay, so diaphragm and pelvic floor, they work in a pressure relationship. Fine. So whenever the diaphragm would descend, means whenever there will be inspiration, the pelvic floor would relax. And whenever there is expiration, the pelvic floor should contract. So this is, it should be a piston movement. And why is it required? To maintain a proper intra-abdominal pressure, thus maintaining the core stability. So the way your transversus abdominis, it holds, it bounds your abdomen, and it does not, if it's weakness, or if the person is having excessive pot belly, the stretching or the weakness of the transversus abdominis leads to core instability. Similarly, the disintegration between pelvic floor movement and diaphragm can lead to core instability, and along with the tightness or dysfunction of the multifidus. Okay, so that's the reason that all these four should be evenly evaluated and should be evenly given an importance. Okay, So going back to my slides, what simple steps, what 3 simple steps you can do in order to integrate the pelvic floor muscles, okay, or to activate your pelvic floor muscles. So the 3 simple steps which you can take. The first and the foremost is educate your patient about core muscles. Educate your patients about pelvic floor. So many a times what happened that whenever a patient has been referred to us, either from any of the medical faculty, or the patient is in a step-in patient, or he or she comes by himself or herself, we explain them about the different reasons. For example, if the condition is maybe degenerative joint disease, we would explain that as you are aging, your muscles go into the degenerative changes happens to your bone, the disc gets degenerated, the water content of the disc is reduced, your posture changes. So all these education we are giving, but along with that we need to integrate one more thing, that is explaining them about the pelvic floor muscles, or giving them a complete idea of what do they mean by core. Okay, what do they mean by core? So that is the, I'll just like to get my laser pointer. Yeah. So first is educate them about core muscles. Second is post education, have them understand, have them activate pelvic floor muscles, not simply by giving an active command of Kegels, but by using wow pf 360. Now what this wow pf 360 is, I would demonstrate it to you. And third is by giving them an appropriate home exercise program. Okay, so first and the foremost thing is to educate the patient about pelvic floor, or educate the patient about all 4 components. They'll explain them the importance of their private muscles, the pelvic floor muscles, in back stability. Explain what happens to their private muscles or pelvic floor muscles if the patient is obese along with back pain. Okay, so you need to give her a proper education about all these 4 muscles and their integration. Okay, second step is you add whatever you are doing in your back pain treatment. We are so proud of all our physio fellows that we are really progressing, and we are really integrating newer techniques nowadays. We are learning McKenzie's, we are learning kinesiotherapy, we are learning dry needling, mulligan, XYZ. There are n number of things which are there. Okay, but along with that, whatever you are practicing, keep on practicing. You are delivering it to the best, but how can we improve the quality? How can we get loyal, how can we get them a complete treatment? So that is just add 5 minutes of pelvic floor rehab or pelvic floor activation. Okay, so instead of just asking the patients to do Kegel exercises, you have them understand that what pelvic floor rehab consists, and how to actually do pelvic floor rehab. So for that I would like to show you wow pf 360. So what we are saying is, like, if you can see into my slide over here, so in my slide, yeah, so this is a this is the figure of a female perineal area. Okay, so here we are saying that you add, no matter you have done pelvic floor rehab or you have not done. Okay, there are a lot many different techniques, there are a lot many different assessment things and everything. But if you are naive into this field, you might be very good into ortho or cardio or neuro, but you might not be practicing pelvic floor. That's respectable, but that does not mean that you cannot do anything beyond Kegels. Okay, so simply this is a very beautiful thing. That's why the word magical is written in the title. It's a very beautiful thing to use a pelvic floor technology non-invasively over the clothes. Okay, so you are using pelvic floor technology non-invasively over the clothes to activate the pelvic floor muscles, that too by additionally adding 5 minutes. Okay, so this is a very basic, no matter there are lot many advancement into pelvic floor rehab, we can go for detailed differentiation, but just to start with, just to help your patient understand what pelvic floor is, you start perineal body activation with wow pf 360. Hmm. So what I'm saying is, in this model, as you can see, okay, so the same pelvis, I'm showing the inferior view of the perineal of the whole pelvis structure. Okay, so here you can see that this is the perineal body. Okay, this is the perineal body. So simply use target activator of wow pf 360 and place it over the perineal body and use the 5 minutes of strength protocol. Okay, so I will show you the remote in the presentation. So you can simply keep the target activator over the perineal body. How to palpate the perineal body on clothes, so that also I'll show practically. You all can practice it right now to find out your perineal body. Okay, keep it over the perineal body and use the 5 minutes of target activation. Okay, 5 minutes of strength protocol, and ask the patient to just follow the commands which are coming on the screen. So we can start the strength protocol, in which the app, okay, the brain part of the wow pf 360 will give the command of squeeze and relax. So when the command of squeeze will come, the patient will feel a mechanical stimulation over her perineal body, and this mechanical stimulation will make sure that the patient is squeezing, will help the patient to squeeze the pelvic floor muscles. Okay, so this strength protocol, when you would start, there would be a audio command. Along with that, there would be a visual input, the visual in which the patient can see the complete lift of complete lift of pelvic floor. And when the patient will see a complete lift of pelvic floor, ask them to continue it, and then they will get a command of relax. So when they are relaxing, when there is a relaxation on the mobile screen, they need to relax their pelvic floor. Okay, so patient would get a 3 inputs: audio, visual, as well as tactile. So that will help them to activate the perineal body in the most beautiful way. Now the question which can arise is, why only perineal body? Why not any other part of the perineum? So the answer is here, that as you can see into this wheel, right, you can see a center axle and the spikes which are attached to the axle. So any force which is given to the spike, sorry, any force which is given to the axle will be traveled towards the spike, right? So similarly, for the perineal body, okay, there are a lot of muscles which are present, but the muscles, they are generally attached to the perineal body. Okay, moreover, the nerve supply towards the perineal body is also very good. So when you are activating the perineal body, you are indirectly working on all the different muscles of the pelvic floor. So you don't have to invasively treat the patient. Those who are already doing invasive work, fantastic, keep doing that. those who are hesitant of doing invasive work, or those who have not learned transvaginal transrectal pelvic floor rehab. And if you are treating back pain patients, I'm sure you might be treating, instead of just asking them to do Kegels, have wow pf 360 and use it for activating non-invasively over the clothes for the perineal body. Okay. And at last, for your home exercise plan, you can have patient to do. Now this is one more thing which is coming out to be, and that thing is like many patients, they are not very compliant to do pelvic floor exercises at home. So if you ask them to do okay, you have to do Kegel exercises once a day, 30 repetitions. The next day they might come up with 0 repetitions. And then they will blame that there is no improvement. मुझे तो कोई फर्क नहीं पड़ता. Why? Why? That we need to understand that, see, first and the foremost thing is we have not giving them a proper education about the pelvic floor. So they are actually not aware that what exactly would they squeeze will stop their urine, and they will end up into Valsalva. First thing. Secondly, they might use all the adductor, all the accessory muscles, the adductors, the abdominals, everything, but still they might not be able to have an isolated contraction of pelvic floor. And third, because they don't have an objective, it is a human tendency, it is in human psychology that you would only work if you have an objective. Very less people are self motivated. Others, they need some external input to work. Okay, so if you ask a patient to do biceps curl with 500 grams of dumbbell, so she is seeing the dumbbell, she is feeling the dumbbell, and she knows that she has to flex it in this way, because her eyes are seeing and her brain is knowing. But for the pelvic floor, for the Kegels exercises, the patient have hardly seen their perineum. Okay, elbow joint you are seeing every day. Your perception or your brain perception of elbow is wonderful, because your eyes are seeing, your eyes are registering. Okay, there is a saying which says that the brain knows what your eye sees. Sorry, the eye sees what your brain knows. Okay, so now you have never seen the perineum, you have never seen what the pelvic floor muscles are, how do they look, what do they function, and then you are asking the patient to squeeze it 10 times, 10 times in a row for 3 times a day. So that is very boring. It's not cumbersome, it's not something unachievable, but it is very boring for them. So you need to have some audio visual input also, and that audio visual input is also been taken care by the Wow Group mobile application, which is a free application to use. So you can download Wow Group mobile application, and you can use the pelvic floor exerciser into it. Okay, which can give you the commands of squeeze and relax. So you can hold, and you can see that the pelvic floor muscles into the visual input is going up, and then you can relax. So this way you are giving a audio visual input. This way you are giving an audio visual input to your patient. So I'm doing it once again. Squeeze. And now I'm really removing it. Relax. So the patient will get an audio input, the patient will get a visual input, and the patient will also see that how many seconds can she hold. So you are giving her an objective goal that good, you did it 5 seconds yesterday, try to do it 6 seconds today. So even the home exercise plan becomes easier. Right? So 3 sets of 5 reps of 5 seconds hold, progress to 3 sets of 10 reps of 10 seconds hold. This can be a generalized protocol for home exercise plan. And when you see what prognosis we found in our patient, this like the peripheral prognosis is good, and even for the Pelvic floor prognosis also, we found it very good. Okay. Now the question would come that I am already doing good with back pain patient. Why do I need to add pelvic floor rehab, that too in different way in our routine cases? So the answer is very simple, that just by adding 5 extra minutes of pelvic floor rehab in your already practiced pelvic floor low back pain protocol, you are just what other thing you are doing is you're just adding 5 minutes. Okay, so just by doing that, you can have loyal customers, not just loyal customers, but satisfied and loyal customers. Now what do I mean by satisfied customers and what do I mean by loyal customers? Okay, so a simple example is a patient who is coming to you with back pain. She's getting treated, she is going, and she is satisfied with you. But if you are not available, she can go to any other physio and do the treatment. She is satisfied with that physio also. Same patient is coming to you. She is taking the treatment from you. She's so satisfied that if you are not available, she would wait for you rather than going anywhere else. Or she would refer all her colleagues, all her relatives, all her friends to you. Or even if she is moving to another place, she would still travel to come to get treated by you. That is a loyal customer. So simplifying it, you are a pizza fan, you love pizza. This is an example given by Hetzer to understand that what is a satisfied customer and a loyal customer. So giving the same to you, that you are a pizza fan and you love pizza a lot, so you are satisfied with all the pizzas you eat. On the contrary, you are pizza fan and you are only satisfied if you eat the Domino's pizza. So no matter wherever you go, you would still order the Domino's. So that is your loyalty towards the Domino's pizza. Okay, so similar way, what we want for you, I mean what wow group, what sir has envisioned for all our physios is that just by integrating fewer techniques into your already established low back pain treatment, you can earn the loyalty of your customers. Okay, and how can you do it? By explaining and what other benefits can you get it, I mean, so you, the other benefits which you will get is you will get better core stabilization, trust building, internal referrals and external referrals. So the first is getting the unique reputation. Okay, now you can see the image over here that there are multiple physios but you are standing out. So what do that mean? Now Rita, what did she reported to us is like, I visited 4 5 orthos and many physios, but none of them they explained me core and pelvic floor in this detail. And I'm so lucky to meet you as a physio, because I realized that the role of my private muscles or my pelvic floor muscles is way more important in back pain. So you are getting a unique reputation. All are serving the same thing, but you are giving something different to the patient, to the population. Okay, so unique reputation. You are having internal referrals. So when we say internal referrals, what do that mean? That mean like the Rita, she said me that I was not comfortable in the beginning to talk about it, but I'm suffering from urine leakage too. So once I'm done with pelvic floor rehab, can we once we are done with low back pain, can we start with pelvic floor rehab? So the same patient who came for low back pain, she turned out to be a patient for pelvic floor. So that is an internal referral. And then external referral is by making them your fan, giving such a wonderful quality, giving such a wonderful treatment to them that they become your fan and they refer other patients to you. So that is an external referral. Okay. So yes, this is like for this presentation was for the one who are not into the pelvic floor. But if you are too much passionate about pelvic floor, if you are too much passionate about women's health, you can come up and take the webinars with us or the workshops with us, where we discuss a lot about the pelvic floor rehab and management. But this was just a minimalistic approach, that being a physio, instead of just advising Kegel's exercise, it would be better if you advise or if you do their treatment with Wow PF 360. So these are the simple take home strategies. That ask yourself, do you treat back pain? Yes, you definitely treat back pain. Do you have Wow PF 360? If no, have it. Okay, continue your routine treatment. Add 3 steps to it, that is core explanation, PF360 activation, so PF360 activation for perineal body, and home exercise plan. So if you do this, what would you get? So you'll get you can have better patient counseling, because now you are explaining her about something which was not explained to her by anyone else. Okay, better core stabilization, you are working for the pelvic floor also. Better results, highly satisfied patient, unique reputation, internal referrals, external referrals, opportunity to expand your practice to a new pelvic floor dysfunction diagnosis, and new heights for your reputation and expansion of practice. So, yeah, in the summary, if you are a physical therapist, if you treat back pain, or if you treat sports patients, or even if you are treating cardiopulmonary patients or neuro patients, any patients, okay, you cannot miss the revolutionary core activation through magical integration of pelvic floor. And don't wait for a competition to begin. Be aggressive, be go-getter, and be successful. So before ending my speech, I would like to go back to the um, practical demonstration of how to palpate perineal body in the patient, for male as well as female, and how to place Wow PF 360. Okay. So I am just turning my audio and video off for a few seconds, and I would be back. Yeah, sorry, I was on mute. So I'm saying that this is the pelvic model and the perineal body. So I've already said that we would activate the perineal body like this. Now, how to palpate the perineal body through clothes? Because here, that is what we wanted, that if you are not into pelvic floor rehab, still how can you use the Wow PF 360 for treating the patients with low back pain? So what you need to do is you simply ask your patient, okay? The clothes are on. What you have to do is, you if this is the whole perineal area. Okay, so just palpate, ask the patient to put one hand, one finger, the hand over the vaginal opening, so the birth hole, and one at the poop hole. Okay, and keep three fingers vertical. So if I'm keeping three fingers vertical like this, from my birth hole to my poop hole, the middle finger generally would be, I'm using the word, the middle finger generally would be at the perineal body. So this, okay, birth hole, one finger, on the other finger on the poop hole, that is the anus and the vagina, and the middle finger would be your perineal body. So simply keep the target activator over the perineal body. Okay, this would be for female. For male, what you can do is, like in male, they would, instead of having the vaginal opening, they would have scrotum. So you simply ask the patient to retract the scrotum up and flap it, and then from the point between the scrotum and the anus would be the perineal body. Okay, so for female, the command would be between the vaginal opening and the anus. For the male, the command would be like, the retract the scrotum. Okay, this is the scrotum, just retract the scrotum, and between the scrotum and scrotal skin and the anus, you will have the perineal body. Okay, so it is a very simple way. You need not have to undress your patient, or you need not have to be uncomfortable if you are new into this field. Still you can take care of your patients who are having back pain. So you can use this integration for the treatment of low back pain. So going back to my slides, I hope you were able to understand the demonstration. Yes, so this is all from my side. Once again, thank you very much for Hetzer for giving us a platform to speak about the silent suffering, for explaining us, and for giving us a vision to fight against this silent suffering. And thanks to all of you, the panelists, the audiences, to be with us and to listen to a wonderful topic. I would like to thanks. I'm just stopping my screen sharing. I would again like to thank Dr. Sanjeev Jha, Dr. Ruchi Varshne, Dr. Pooja Shetty, who was coordinating with me, Dr. Dr. Payal Pal, Dr. KK Kant, and Dr. Kaushik for organizing this wonderful webinar. So this is all from my side. If there are any questions, I would be very happy to share it with you. And if you have any queries related to pelvic floor 360, wow PF 360, or different workshops and webinars which you are doing, you can anytime WhatsApp me on my WhatsApp number 8000521 503. I'm repeating the number 8000521 503. Or you can even visit our website, that is www.visionwowgroup.com/IPRE. IIPRE. Repeating once again, www.visionwowgroup.com/IPRE. Thank you.
Thank you, Dr. Dhara Shah. And it had been a wonderful workshop, webinar that you took up, and we are flooded with certain questions. So I would like to put it one by one. The first of all is how to activate the pelvic floor without the device. Uh, this is the first question.
Okay, so see, how, if you, I mean, if I have to reframe it, like if you don't have WOW PF 360, what you will do in that case, right? So in that case, see, activating the pelvic floor muscles, you need to give a proper education to the patient that what exactly the pelvic floor muscles are. how to differentiate those, how to palpate those muscles. And once she understands that what these are, you can have her you can have your patient look her own perineum in the mirror. So ask her to look into the mirror. Okay, she can do this exercise at home also, that observe your, undress yourself, observe your perineum in the mirror, and then try to squeeze. So if she will have a good muscle tone, if she has good pelvic floor control, she will be able to realize the squeeze. But only squeeze is enough? The answer is no. Ask her that whenever she is squeezing, her breathing should be continuous. So squeeze and simultaneously talk, or recite 1 2 3 4 something, so that you don't breath hold and you don't end up into valsalva. Also make sure that you are not using the adductors, so your legs should be fully abducted. Okay, and if the adductors are tight, then supported with the pillows beneath.
Okay, that's, I think, much clear. So next question, our co-moderator, Dr. Kant, will be asking. Sir, please carry on. Uh, Dr. Kant, you are not audible. No, sir, you're not audible. Okay, let me put forward. The next question is, Madam, how many repetitions of Kegel exercises to be done by the patient?
Right. So now again, see, I in my presentation, if you see, we have made that. I'll just go to that slide once again. Now this what we have I have written here, that you can go for 3 sets of 5 seconds, 3 sets of 5 seconds hold 5 reps, and 3 sets of 10 seconds hold 10 reps in a progression. Now this is the simplest thing to start with, that you ask the patient to do 5 seconds hold, 5 second relax, 5 seconds hold, 5 second relax 5 times, and do it 3 times a day, and slowly progress it to 10 seconds hold, 10 second relax, 10 times for 3 times a day. Again, I would like to mention here is, this is a minimalistic thing which you can do. I mean, the minimum you should do for your patients. But again, the pelvic floor patients can be of two categories: hypertonus patients as well as hypotonus patients. So if the patients are suffering from hypertonus, I mean pain, tightness, discomfort, then in that case you need to have a detailed evaluation, and in those cases you will not advise them upfront pelvic floor contractions. So for home exercise plan, if your patient it will be depending upon, and even for hypotonus it would be like what level of strength the patient has. Okay, or what is the endurance of the patient. But if you don't want to go in that depth, this is the easiest thing you can advise to your patient, that 5 seconds hold, but make sure the number of seconds the patient is holding, same number of seconds the patient should relax. So you are not overfiring, or you are not making the muscles more fatigue. Okay, so 5 seconds hold, 5 seconds relax, and progress it to 10 seconds hold, 10 seconds relax. Yes, I guess that has been cleared, the question. I mean that the doubt has been cleared. Do we have any other question? Hello, can you hear me?
You are audible, ma'am.
Yeah, so I think that I have given the answer. Do we have any other question?
Maybe our moderator is with us. She will tell. Dr. Payal Pal,
Okay.
please hide the share screen, ma'am.
Yeah, I'll hide it.
Madam. Maybe some network issue is there. Maybe the Dr. Pal is not able to connect. On her behalf, I just show my gratitude towards IAP Daily, and thanks a lot for the wonderful webinar and the
Thank you
very
very much.
nice demonstration you have given. And that's really very much knowledgeable webinar today you have given. And I just again in the last tell everyone to subscribe IAP India YouTube channel. And with this, with a gratitude towards everyone, all the delegates, I'm just winding up this webinar. Thanks a lot.